Kid Poker, 07. Long distance runners develop plaque for some reason. There's several things. There's a couple of things that go on with long distance runners. I've been a long distance runner. I've run, I don't know how many marathons. When I was at Toyota, I used to do a half marathon once a week just for practice and to stay in shape. And then we'd have a couple of times per week where we would do the equivalent. It'd be running 2 or 3 hours full court basketball. One of the things that happens with that much running, long, slow distance or endurance training is that the muscles get small. And, you look at a distance runner, tiny muscles. Here's one of the problems with that. And we see that especially as people get over age 65. Loss of muscle mass is very much associated with inflammation. Now, this gets into some of the things about assumptions, filters, and garbage in, garbage out in terms of logic. Don't take that last statement as saying, well, long distance runners are going to have heart attack and stroke risk, because that's too much of a jump as well. You do have to be aware that decreased muscle mass is a risk factor. And especially as you age past 65, you need to do that. So why would I caution against saying long distance or endurance runners are inherently going to have increased risk? Because of what they do 3 and 4 times a week. If you're doing long workouts 3 and 4 times a week, you're keeping your muscles in a space that even though you may have less muscle mass, they're still having that insulin effect. Now, what do I mean by insulin effect? Here's why muscle mass helps. Muscles, when they are working, bypass ailing insulin receptors. So when we get somebody on board and they have insulin resistance, one of the first things that we'll do is prescribe a thing called the Freestyle Libre. If you have any interest, I've got several videos on it. It's a white plastic button about like this. It's got about 1/3 of an inch filament on it. That filament goes under your skin. And what this thing does, the Freestyle Libre, is it measures your blood sugar 24 hours, 7 days a week for 2 weeks. Now, one of the first things that people discover is, well, I knew that working out would decrease my blood sugar for the most part. Again, there are exceptions for that as well. But I didn't know that just taking a simple walk would do that. And sure enough, if you go on a carb vacation, you drink a beer, you eat a pizza, you go to a birthday party and have a birthday cake. If you're an insulin resistant person or pre-diabetic or diabetic, your blood sugar is going to start to spike. If, however, you decide to take a 15-20 minute easy walk, the activity of the muscles in your legs will pull that blood sugar out and cut the top off of that spike. Well, here's the other thing that happens. The larger the muscle mass, the more intense the workout, the larger and longer that insulin-like effect. Well, if that's the case, now start thinking about it. If you look at the prevention data, maybe there's a reason why we see over and over again that if you have at least 3 large, hard workouts per week, that has a huge impact on your cardiovascular risk. I'll leave those dots for you to connect.